a rich man's world. I have turned the soul of this beautiful land, but the beauty a rich man's world. I have turned the soul of this beautiful land, but
What's up, everybody? Happy Thursday. I hope everyone is having a blessed day. So today I've come on here to talk about this deadly fungal disease that has started to plague the United States and different parts of the world. And it is considered to be what's called a possible pandemic, another one, yes, yet another one that's coming our way, if this isn't, put under control. So the deadly fungal disease is called Candida auris. And what it basically does is that it targets and harms the elderly as well as people with compromised immune systems. So according to the CDC, Candida auris is an emerging fungus that presents a serious global health threat. So the CDC is concerned about the C. auris for three main reasons. Number one, it is often multi-drug resistant, meaning that it is resistant to multiple antifungal drugs commonly used to treat the Candida infections. Some strains are resistant to all three available classes of antifungals, okay? It is difficult to identify with standard laboratory methods and can be misidentified in labs without specific technology. So misidentification may lead to, inappropriate management, aka false positives. So it has caused outbreaks in healthcare settings. And for this very reason, it is important to quickly identify the C. auris in a hospitalized patient setting so that the healthcare facilities can take the special precautions to stop the spread. Now, the CDC encourages all U.S. laboratory staff who identify C. auris to notify their state or local public health authorities and the CDC. And of course, the website is Candida Auris at cdc.gov. I want you guys to look at these news clips, and I'll be right back.
Fungal infection is spreading at an alarming rate through healthcare facilities across the nation. That's according to a new report from the CDC.
The agency says the number of cases that actually caused infection nearly tripled during the pandemic. Fox 5's Joy Dukes explains the concerns that health experts have, especially for immunocompromised people.
Experts I spoke with say Candida auris isn't much of a concern for healthy people, but it poses a major threat to people dealing with an illness because of how rapidly it spreads and how resistant it is to even the most highly recommended antifungal medications. The CDC has issued a warning on a rapidly spreading fungal infection that's been identified in more than half of the states across the U.S., including Georgia. Officials say Candida auris was first reported in 2016, but saw a 200% increase in cases during the pandemic.
What's interesting is a lot of the same populations that we were really concerned about with COVID-19 are the same populations we want to extend extra care when it comes to Candida auris.
Medical microbiology expert Dr. Amber Schmidtke says it's a big concern for immunocompromised individuals, especially those in hospitals, nursing homes, and other long-term care facilities.
It is something that primarily affects folks that have underlying medical conditions.
Dr. Karen Norris of UGA's Center for Immunology and Vaccinations tells Fox 5 that concern stems from how easily Candida auris spreads and how resistant it is to three of the most common antifungal medications.
So that is very, very concerning because then it really limits the ability to control the infection in individuals that are already susceptible.
Norris says researchers at UGA are currently working on a vaccine that has shown signs it could treat the fungus. It's still in its early stages of clinical trials.
So our vaccine is, we call it a pan-fungal vaccine, and it hits three of the most prevalent types of these infections.
While the CDC says cases overall remain low, officials say they are working with state and local health agencies, healthcare facilities, and clinical microbiology laboratories to ensure they are using proper methods to detect and prevent a potential spread. Experts say practices like hand washing and cleaning healthcare facilities will also help prevent the spread. In Atlanta, Joy Dukes, Fox 5 News.
The alarming spike in cases has been discovered in more than 15 hospitals and long-term care facilities across southern Nevada. The dangerous and sometimes lethal drug-resistant fungal infection, Candida auris, is spreading across the state at the nation's most rapid rate. The CDC just warned the fungus posed a significant threat nationwide.
In a lot of situations, investigation will reveal that there are many more cases. And, it's just the tip of the iceberg, and it's been spreading undetected for some time.
Showing it can evade antifungal drugs, Auris, as it's known, can infect the bloodstream, heart, or brain, and is mostly connected to patients in healthcare settings. Spread from surfaces like bed rails or pieces of equipment, the fungus can also survive on the skin. Now in Nevada, where there's more than 1,000 cases, there are signs of community spread.
A lot of these patients are coming in with the infection already. And they have no previous medical history. So in those cases, we know they had to get it somewhere.
Quick to point out, Auris isn't viewed as the next COVID. Health officials still say if it's not quickly contained, it could become a public health risk.
As the CDC works to find better treatments, those who are healthy are typically not at risk. But tonight, as cases climb nationwide, so is alarm. Miguel Almaguer, NBC News.
Now, y'all just saw those disturbing news clips, and this is a concern for not only the elderly and folks with weakened immune systems, but for housekeepers as well, the folks who clean these facilities. Extra precaution is needed in order to remain safe, as let's just say proper hand washing, changing of the gloves. And even though this is common sense, I'm just going to throw it out there. Folks, please wash your hands after you use the bathroom. Since this is rather new to the set public, I'm hoping that there are some mandatory trainings that, that are implemented in regards to healthcare workers, so they can successfully decrease and possibly combat this deadly fungus. Also, for everyone out there who's caring for an elderly relative or even loved ones who, let's just say, take dialysis, the list goes on and on because there are many ailments out here that can weaken your immune system. Keep an eye out on them, Keep them away from germs and if they take vitamins, make sure they're taking them. We're living in some really strange times right now. And I strongly believe a lot of this crazy famine, amongst other things that are happening in the world, is to remind us to start loving one another again, to stop all this hatred, as well as helping your fellow man when in need. All right, y'all. Let me know what you think. Leave a comment down below. Like, share, subscribe. I'm out.
A rich man's world.